Okay, so let's talk about some respiratory anatomy. So we're starting here with the upper respiratory tract, so your head. So when we breathe in order to get the air down to your lungs for gas exchange, there has to be a way in. So when we breathe in, air can go in through the nostrils or nares or through the mouth. So we breathe in through the nose, the air comes in here, and you should really know what these little shelf things are. These are called the nasal conchae. And there's three of them: a superior, a middle, and an inferior nasal conchae. So air comes in here, and these conchae that are covered with membrane, mucous membranes, cilia, and all of that. And the stuff there, and these little shelf things called conchae, they make the air rough. They make it like turbulent and mix it around. And this is what causes the air to the mixing of air allows it to warm and humidify. Warm and moist. So it comes in here and does that. And as it comes back, it enters the nasopharynx. There we have three pharynxes, and the top one, just up in here, is the nasopharynx. The nasopharynx. And in the nasopharynx, you'll see the entrance to the auditory tube. Which connects the nasopharynx with the ear, with your inner ear. So when you feel pressure in the ear, you yawn, it opens that auditory tube and releases gas and equalizes pressure there. All right, so the air goes through the nasopharynx, then it enters the oropharynx. Which is behind the mouth, the hard and soft palate there. Here's the uvula little thing. You got some little tonsils here, palatine tonsil, and I forget what this one is, lingual tonsil, I guess, where the tongue is. This is the tongue here. And the air then goes down into the laryngopharynx. Laryngopharynx. So you'll see here we are in the laryngopharynx. In the laryngopharynx, so it's where the air comes down and will enter the trachea. So this thing here is the trachea, which is the tube that goes down to your lungs. Right here are your vocal folds or vocal cords. And this thing right here is a little device called the epiglottis. And the epiglottis, when you eat food, the food is in here in your mouth and it comes down. And when you swallow, this structure folds back and covers the hole that goes down into the trachea. So it keeps food from entering your lungs, entering your trachea, and forces the food down into the esophagus. So the esophagus is just posterior and kind of lies on top of the trachea on the back side. This thing right here, this whole area is kind of rounded by cartilage. So this is the thyroid cartilage here. Back here is the cricoid cartilage. And this is all hyaline cartilage. The epiglottis is elastic cartilage. Okay, so that's the main sort of structures that are in the head. So we'll look a little bit closer to the laryngopharynx, the larynx area.